Lateral epicondylitis, also known as tennis elbow, is the most common overuse syndrome in the elbow. It involves extensor muscles of the forearm. It occurs often in repetitive upper extremity activities such as computer use, heavy lifting, or repetitive vibrations. It's also seen in people who play sports such as badminton, tennis, baseball, swimming. So in this video we are going to see exercise program for tennis elbow and also some manual therapy techniques that can help patients. So for wrist extensor stretch, if your hand is like this, for example, you turn it around and you bend your wrist like this, right? So you can give further stretch with your fingers of your other hand. So you should feel stretch here. Mainly here, if you have tennis elbow, you will feel some stretch here. Wrist ulnar deviation. So move your wrist towards the little finger side and then return in the midline. Make sure the movement is happening only in the wrist and not in your elbow or shoulder joint. Wrist radial deviation. Move your wrist towards the thumb side and then return it back in the midline. Make sure the movement happens only in your wrist joint and not in your elbow or shoulder joint. Finger opposition. Touch the tip of the thumb to each finger one by one. And you make sure you are extending other fingers and stretching them really good. Reverse prayer stretch. So place back of your hands together to stretch the wrist, and if you want to increase the stretch, then bring your wrist little up. You feel it more here? Rubber band extension. So in this exercise you expand a rubber band wrapped around your fingers and push the fingers out as much as you can, and you can even adjust the rubber band at different levels. Elastic band wrist curls. So in this exercise you put one end of the TheraBand underneath your foot and the other end you roll it around your wrist or hand and hold it tight. Now stabilize your elbow and rest your forearm on your thigh, or you can even rest it on the table. And now holding an elastic band, bend your wrist upward with your palm facing up. And you can adjust the TheraBand strength, whatever is appropriate for you. Elastic band wrist extension. So put one foot on the TheraBand and the other end of the band you loop it around your fingers and turn the hand around and stabilize your elbow with the other hand. And now while holding an elastic band, bend your wrist upwards with your palm facing down. Elastic band radial deviation. Rest your forearm on your thigh and stabilize it. And while holding an elastic band, bend your wrist upwards and make sure your wrist is in the neutral position. Bring it away. Weight pronation supination. You can start with no weight and then increase weight slowly. Here we are using 3-pound weight. So slowly lower weight towards the inside and then outside of the body Make sure the movement happens from elbow and it completes at the wrist. Pronation using weight. So slowly lower weight towards the outside as shown and then return. And this exercise you can also do with the help of hammer. So again, you don't have to use 3-pound weight. You can start with a very light weight. You put it in your hand, okay? You bring your wrist up with your good hand. You stabilize it so elbow doesn't move, shoulder doesn't move, and you slowly bring hand down. So that's called eccentric wrist extension. Slowly bring hand down. Using weights, now we are going to perform ulnar deviation. So rest your forearm on your thigh. You can use a pillow and then stabilize the elbow. And now while holding weight in your hand, move your wrist towards your little finger, towards ulnar. Make sure your wrist is in the neutral position as much as you can. Radial deviation with weight. So we are using 3-pound weight, but you can perform this exercise starting without weight and then slowly increase the weight. Stabilize your elbow with other hand and then move your hand towards your thumb and go again back in the midline. This is a towel grip to improve strength in your grip. Squeeze hard and relax. Yep. And you can do it other way around also, actually. And to strengthen wrist extension, you can grip and extend also, and then relax. Extend and grip and relax. For self-mobilization for tennis elbow, you can use one towel here above your elbow joint, just above your elbow joint. You put your other arm, rib space of your other arm just below your elbow joint, and move hand that outside. So I'm keeping my right side tennis elbow. You can move it around. So I personally feel more stretch when my thumb is up. So you can move around and see where you feel a nice stretch. You hold it and relax. So a lot of times with tennis elbow, you find gripping is difficult. So you can hold a small towel in your hand and you can grip it while giving the stretch, and actually then gripping feels better. I can do it way longer, and this feels much better for me personally. So you have to find your own angle where it feels good. Again, if it hurts, don't do it, and always check with your therapist. So for tennis elbow, the wrist extensor muscle, so even if you just push your hand towards me, your wrist towards me, and you will see these muscles pop up. They kind of, do you have any pain here? No, right? But that's kind of where they insert on the lateral epicondyle, and sometimes you may have pain just few centimeters below the location. So right here. So what you can do is, if find that painful spot, you feel the tendon moving. So you just move the tendon. Do a friction massage. So tendons are going like this, you give perpendicular friction massage like this, and it may be painful for first few seconds, 30 seconds or so, and then the pain should go down. You put one towel here And I'm gonna give her a traction, and bend. And now, somebody who doesn't have any elbow issues or tennis elbow may not feel much, but otherwise you may feel some nice traction. Thanks for watching our video, and please visit our website for more physical therapy videos.